How did I get involved in cancer disparities research and what led me to this area of research? Well, I'm not even sure how to answer that story. I do know this, is that I've had my own been exposed myself to disparate care as a patient. And also, I think what led me to the research aspect of it was this. As a resident, I had a gentleman to come see me. He was 59 years old. He had private insurance, and he came to see me in our ward service clinic. That meant that he waited for about 3 hours to see a resident because someone in his family had told him that they saw me give a talk in the church about prostate cancer. Now, this gentleman had been diagnosed 2 years before with a treatable cancer, but when I saw him, it had already spread to his bones. So the question for me was, why didn't this gentleman get treated? He was educated, he had insurance, so he had quote unquote access to care. However, he did not receive appropriate care. So I started asking some questions to myself. Was it, he didn't know what should happen? Was it that the system didn't work for him, so he fell through the cracks? So I did the Roberts O. Johnson Clinical Scholars Program, and I sort of took this on to sort of understand why men make treatment decisions, what's the process, what's going on to lead to African American men dying more from prostate cancer. As you know, that black men are twice as likely to die from it compared to white men. The community feels, as we see, disengaged from the healthcare system. So anytime the system reaches out to them to sort of make them more engaged, sort of to build a collaborative relationship so that we can improve their health and healthcare, they respond to that positively. Now, some of that is because that I'm a member of the community. Some of it is the fact that I'm a member of this other community, those with MDs, those who have not built a relationship with the community, they respond to that in a positive way as well. So they understand the needs, they want to participate. It's up to us to create an environment, an atmosphere where that's possible. Number one, we have greater research. We have a few more resources. We have a great deal more discussion. We have some solutions that may or may not work. And the reason I say may or may not work because they haven't been implemented in a substantial way. So we have momentum. Momentum's good. However, we don't have progress until we've healed. Right? Progress is not making a step forward out the room. Progress is when you're out of the room, down the hall, and out of the building, then you have made progress. So until we say substantial reductions toward eliminating healthcare disparities, be it from we now have magic bullets to treat people for certain diseases, and we give those magic bullets appropriately to everyone, yes. Or is the fact that this community, whatever that community is, feels welcome in the hospital that's right around the corner from them, then yes. Until that's done, we've done some of that, but we haven't done enough. I am a urologist. I am an expert that looks at disparate care in prostate cancer and other cancers, but I'm also a black man, right? And that comes together in a very unique way. So as a black man, I think, yes, we need to assure that black men and others, like my family, have proper access to care, right? As a scientist, I'm like, there has to be a solution to that. We have to figure that out. As a physician, I'm appalled by it and sickened by it. So yes, that all comes together in a very unique way to say, enough is enough and too much stinks, as my mother would say. And it's time to end this. I guess Martin Luther King said it best. Injustice anywhere is a threat to justice everywhere. No one is safe from healthcare inequities as long as the least of our citizens have any inequities in healthcare, period. That's across the board. If you allow it to happen to one, you create a process that allows it to happen to everyone else. So when I say things like these disparities sicken me, that sickens me because I don't understand why that should exist. When we know that black men are more likely to die from prostate cancer And when they have a treatable cancer, but an aggressive treatable cancer, and that they're likely to die from it if not treated, why aren't they being treated? Regardless of age, whether or not you're young, 55 or less, or older. Black men are still less likely to receive treatment. Those disparities do not make sense to me. When we have eliminated healthcare disparities, and if there's something that I've done to contribute to that, then I will feel happy and proud that I've made that contribution. But until then, until we're fighting that battle, until this war is over, my answer has to be no, because I don't think I've done enough. I don't think we've done enough.